Hi all, welcome to Oet Speaking and Writing. Today we can discuss an Oet roleplay cat bite. Here the setting is an emergency department. 25-year-old man came with the complaint of cat bite. Here we consider the patient is unknown. So we can start by saying, "Good morning. Please come in and have a seat. My name is Sarah. I am the registered nurse on duty today, in this emergency department. How can I address you?" Probably patient may tell his name. Let's consider the name is John. Then we can ask, "Okay Mr. John, how can I assist you today?" Then patient will tell about cat bite. Next, we can assure him and collect some history. We can tell like, "Mr. John, I understand you are in a difficult situation. Do not worry. I will look into that. I will explain what to do next. Before that, I would like to ask you some questions regarding the incident." Then we can ask questions like, "Can you please explain how it happened? Can you remember the time of bite? Do you have any pain? Can you please rate your pain on a scale of 0 to 10? Where 0 means no pain, and 10 is the worst pain you ever had." Probably patient may tell you like, "Nurse, I will say 3 out of 10. So it's a minimal pain. Do not worry. I will give you appropriate measures to minimize your pain. Have you tried any remedies?" Then, patient may tell like, "Yes, nurse, when I saw the bleeding I immediately rinse the area with sterile water." Then we need to appreciate the patient by saying, "Excellent John, you did the right thing by washing the area. Did you apply any particular medication after rinsing?" "In fact, no nurse. I only cleaned, but I am concerned as it is still bleeding." Then we can assure him by saying, "Mr. John, I completely understand your concern. No need to worry. We can definitely help you. If you don't mind, can I examine your wound?" "Sure nurse." Then after 1 second you can tell like, "Thank you Mr. John, I have completed the assessment. Based on my examination, I can confirm that your wound is bit deep into. That's the reason it is bleeding. Could you tell me, when was your last dose of tetanus injection?" Patient may tell you like, "If I remember correctly, I took tetanus vaccination when I was in school. That means it was around 15 years ago. Yes, in that case, you need to take a booster vaccine. Is that okay?" Probably patient may tell like, "Nurse, I already took the vaccine when I was a child, so I don't think about the need of repeating." Then we can say like, "I understand your perspective, but Mr. John, tetanus is a fatal condition and the vaccine is effective only for 10 years. In your case, it's more than 15 years already. So, it is very important to take a booster. I am afraid to say this, if you didn't take it, sometimes it can cause muscle cramps or lockjaw and ends up on affecting central nervous system and lead to life-threatening situation or even death can occur. Is that clear to you?" "Yes, nurse." Now, the next step is doctor will come and assess your wound and provide you appropriate treatment. Is that okay with you? Is it necessary nurse? I think I can manage the remaining care at home." "No, Mr. John, it's not like that. Your wound is deep, and it needs a proper evaluation from doctor and your treatment may include antibiotic cream for healing. So, please wait to see the doctor. Meanwhile, are you ready for taking the booster dose of tetanus? Because, when I informed about your condition, the doctor has ordered tetanus injection for you. If you have unbearable pain, let me know. I will give you pain medication after checking with the doctor." Then, we can wind up by saying, "Do you have any concerns?" "No nurse, you clarified all my queries. Thank you Mr. John, I am going back to nursing station, and I will be back with your booster dose. In case if you need any help please press the buzzer. Thank you Mr. John. I wish you a speedy recovery." In this way you can